My name is Melanie Mainville, and I will present the self-foot screen for patients to prevent diabetic foot ulcers during a pandemic. I do not have relationships with for-profit or not-for-profit organizations. I do not have any bias. Diabetes foot care during COVID-19. The COVID-19 pandemic has impacted people with diabetes' ability to receive a diabetes foot exam in person related to a decreased access to diabetes care and services. Many primary care clinics shifted to a virtual care delivery model. As a result, this may lead to long-term consequences, such as an increased number of foot ulcers and amputations. Diabetic foot ulcers remain one of the most common complications of diabetes, with up to 25% of people living with diabetes who will develop a foot ulcer at some point in their lives. Regular foot screenings and self-foot care play a significant role in ulcer prevention. The Alberta Health Services Diabetes Foot Care Clinical Pathway, which was created in 2015, provides tools and resources for providers and for people with diabetes to prevent diabetic foot ulcers. We then expanded on these tools and resources to use by primary care providers to ensure that people with diabetes can better assess and care for their feet at home when they are not able to see their healthcare provider in person. We adapted the diabetes foot screening tool for providers, that is on the left side of the screen, to create the diabetes foot health self-screening tool to use by people with diabetes at home to help them keep their feet healthy. The tool was co-designed with patient advisors and primary care providers. It can either be filled up online or printed and filled out at home with the help of a family member or a caregiver if necessary. The tool has been piloted in a primary care clinic in Calgary. The people living with diabetes complete the self-foot screen at home and send the completed form to their healthcare provider via a secure portal. The result of the foot screen is then discussed at the virtual visit with the healthcare provider, and recommendations are made to come for an in-person visit or to send a referral to a foot care provider, depending on the findings. Pictures can be sent to the healthcare provider of any foot problem or of any concerns that the persons might have. And so far, we can say that the initial pilot has been very positive. The tool includes instructions on how to perform the foot screen and how to calculate the overall risk level on the first page. The tool also contains pictures to help persons living with diabetes to recognize foot problems, to know what are the signs of more urgent or high-risk foot problems that need to be addressed in a timely manner. The tool contains instructions on how to perform the touch the toes test to assess sensation, as well as useful links. The care plan that accompanies the tool has been created to guide patients in assessing their overall risk and making decisions on the actions to take depending on their risk level. It also helps to identify foot problems that require immediate attention and prompts the patients to call their healthcare provider right away. It also instructs patients on how to repeat the foot screen depending on their risk level. For instance, if the level is low, then they should repeat the foot screen in about a year. If there is a moderate risk, it should be repeated between 4 to 6 months, and high risk level in 1 to 4 weeks. And for any urgent risk, patients should be seen within 24 hours. In conclusion, self-assessment and identification of foot problems empowers people living with diabetes to be active partners in their care when in-person visits are limited. Shifting foot screening examinations from providers to people living with diabetes may be an effective strategy to decrease diabetic foot ulcers during a pandemic. So this is the link to the tool. It is posted in an external website, so our primary care partners can use the tool. And finally, you can access these tools and resources on the Diabetes Foot Care Clinical Pathway website, ahs.ca/footcare. Thank you.